As a baby massage instructor, I'm a huge fan of holistic health and the many wonderful ways it can help. Women's holistic health is no exception, and there's some great help on offer for fertility, pregnancy and postpartum. In this episode, I speak with Holly Leever, who is a women's holistic health practitioner, and you'll hear from Holly about practices she uses to help women in these areas, including yoni steaming, alvedo abdominal massage and acupuncture. I'm infant massage instructor Helen Thompson. Hello and welcome to First Time Mums Chat. Being a parent for the first time is challenging and changes your life in every way imaginable. To help ease your transition into parenthood, I aim to offer supportive, holistic approaches and insights for mums of babies aged 4 weeks to 10 months old. My goal is to assist you to become the most confident parent you can and smooth out the bumps along the way. This podcast is brought to you by My Baby Massage, so let's do this together. This podcast is for informational purposes only and does not constitute medical advice. Please contact a medical practitioner if you are concerned or have any medical issues. Hi Holly, and welcome to First Time Mums Chat. I'm really excited to have you here because when we first spoke you told me all about steaming, and that really intrigued me because I thought it would be great for mums as well as for me. So can we start by just telling us a bit more about yourself and why you're so passionate about what you do?
Yeah, sure. Thank you so much for having me. Yeah, so my name is Holly Leever, and I have a business called Rosebud Wellness, and I'm an acupuncturist first, and then I've added some additional trainings over the years, yoni steaming, which is what you were just talking about. It's also called vaginal steaming sometimes, so if people aren't familiar with the term yoni, but I can talk a little bit more about why I prefer to use that term over vaginal steaming. And then I also practice alvedo abdominal massage as well. So I specialize in women's health. I work a lot with fertility, with pregnancy, and also with postpartum. Those are kind of my main areas of interest. And also I'm very passionate about working with women just overall in period related or gynecological conditions like PCOS, endometriosis, cysts, fibroids, things like that.
Wow, you've got a very interesting background there. So it's the abdominal massage. I presume that's good for everything, but as a pregnant woman, I guess that's a really, really helpful for mums who are pregnant because it helps. I was going to say, does it help move the baby, or what is it actually? Helps your back and all that kind of stuff. Is that right?
Well, actually, most of the time when I use Arvigo abdominal massage, I'm doing it for women that have period-related issues and are working on fertility. And it's actually contraindicated in the early phases of pregnancy, or if you could possibly be pregnant. So, for example, if a woman is in her fertile window and she has sex and could potentially be pregnant, so there's like a 2-week window where you kind of don't know if you're pregnant or not. So during that time, it wouldn't be advised to do the massage. It's basically like you're not wanting to get any movement into the uterus while implantation is happening and in the early stages of pregnancy. So you don't actually do the abdominal massage until 20 weeks is when you can start doing it again. And there is a separate training for pregnancy that I have not taken yet. I was about to, and then COVID happened. So that kind of like messed with a lot of things because it's a very like hands-on type of course, which wasn't possible at that time. But I did receive the massage while I was pregnant. So I reached out to this woman that does the massage, and she has taken the pregnancy training. And she was the one that told me that I had to wait until I was 20 weeks, which was hard to wait because I really wanted to have the experience. But basically, it's very similar to the massage, how it always is, but it's definitely more gentle. It's still a firm pressure, but with the abdominal massage outside of pregnancy, getting very deep pressure and sort of like pulling up and in on the uterus to try to get it back into alignment. And that's not the situation with pregnancy. You're kind of more firmly but gently guiding the uterus into the more of a centralized position. And then also there's a portion of the massage that is done on the back, primarily the pelvis and the sacrum and the coccyx, which is your tailbone. And so that part you do side lying. So you do kind of like one side at a time, because once you're that pregnant, you can't lie down.
Yeah, of course.
Belly.
Yeah.
Yeah. And then at the end of that massage, which is true of when I do an abdominal massage on anybody, I also teach them a self-care portion where they learn how to do the front portions of the massage themselves. And so she taught me that during my pregnancy, and how it was a little bit different, basically just keeping my hands wider, and all of the markers for like where you're pulling towards were slightly different, because your anatomy just shifts so much during pregnancy. And I really loved doing that. I would usually do it at night throughout my pregnancy. There's also a gentle spiral that's a clockwise spiral that you do at the end to sort of like close the experience and just kind of say good night to your baby. So that was really a sweet little bonding experience for me and my daughter. And she did move a lot during the massage, which she would do during like meditations or shavasana or yoga as well. So it seemed to me like, like a little bit of like a dancing
nice
around.
Bonding,
like, I like this was mostly what I experienced with it in terms of the baby.
Wow, that sounds lovely. I mean, I being pregnant and being able to massage and getting that bond, because I know the feeling when from baby massage, because when they come out and you massage them, you're still having that bonding experience, but having that nice bonding experience when they're actually still in the uterus must be really nice. And I was going to say, because I know with baby massage, I always go in a clockwise direction, because that's the way the digestive system moves. Is that the same as abdominal massage as well? You always have to go in a clockwise direction because it's the way the digestive system moves. Is that?
Yep, that's exactly why. Yeah. So when I'm teaching people the self-care massage, for example, a lot of people, because the way that the spiral is that you start kind of right on top of your belly button, and then you spiral outward, and then you spiral back in, and you do that 3 times. And so when you're spiraling either out or back in, people often want to switch directions, because it's just kind of like, oh, you go the opposite way. But I'm always having to tell people, like the whole time you're staying in a clockwise direction, even though you're shifting the size of your circle or your spiral. But it's exactly because of the way that the digestive system naturally moves.
Does it do any harm for your baby if you do it in another way? I mean, if you do it, because it doesn't for baby massage, from what I understand, I'm not going to say categorically this is right, but from what I understand, it doesn't matter if you go in the wrong direction, but you're not benefiting, you're not doing anything for your bowel. Whereas if you go in a clockwise direction, you are actually benefiting the bowel and shifting all those bubbles and getting all that constipation and all that, excuse the expression, but all that poo out of the other side. Is that, I guess that when you're pregnant, if you do the abdominal massage, the anti-clockwise, is that going to do any harm?
No, I think it's the same kind of thing. It's just not as beneficial.
Yeah,
but no harm.
So let's talk about this lovely yoni steaming, which I'm really intrigued about, because I looked at your website and I sort of thought, oh, I could do this myself. But I actually read your, I think it was, I looked at your video. Was it a YouTube? I don't know if it was a YouTube one. It was on your website, and I sort of thought, wow, this looks amazing.
Sure. Yeah. So yoni steaming. So I usually start with the term yoni because most people aren't familiar with it. I know that I wasn't when I first learned about it. So yoni is a Sanskrit word, and it basically translates to like the entire female reproductive system. So to call it vaginal steaming is just kind of focusing on the vagina, which we know there's so much more to it than that. And it had the steam in particular has such a further reach than just the vaginal canal too. So I think it's important to kind of make that distinction. So it can be used for a number of things. Because I work a lot with fertility, a lot of people come for that. And there isn't like a specific fertility steaming protocol per se. I mostly look at a woman's menstrual history, if they've had previous pregnancies, for example, if there's any kind of symptoms or complications or syndromes or anything like that. That's kind of what I'm taking into consideration when I choose herbs or the specific days of their cycle that they would want to steam, how long they would steam for. And then we also take into consideration any other, like if there's digestive issues or anything like that. So it's kind of, it can be complex, but it can also be really simple if your periods are pretty straightforward too. So that's why I do consults for yoni steaming. If it's a little bit more complicated what a woman is working on, then it's helpful to have somebody kind of guide you through that. So the way to set up a steam is basically you take some sort of clean water source, so filtered water would work, and then you fill up a pot, like a stainless steel or ceramic pot, 3/4 of the way with some clean water source. And then you put in whatever herbs you're going to use. And I have a shop on my website.
Yeah, I saw that.
Yeah. So there's lots of different herb blends. You can also if you're familiar with different herbs that grow around where you live, you can also just use fresh herbs, or you can dry them if you prefer to do that. Either one is fine. A lot of it is just kind of like playing with what feels good to you. But I mean, I would just advise for people to be kind of familiar with what they're working on, that it's not going to cause any like side effects or anything but like rose, lavender, sage, comfrey, calendula, those kinds of things are lovely to work with. Things that smell really good too are nice. So you'll add whatever herbs you're going to be using, and then you'll boil the herbs for 10 minutes, and you can even just burn them on your stove. Maybe I'll just talk about the basic setup, and then I'll get into how you can set them up differently. So you can just boil the herbs on the stove for 10 minutes, and then you take off the lid off of the pot, and you'll want it to cool down a little bit from that initial boil before you actually sit over it. Potentially. And there's a lot of yoni steam haters out there. And a lot of times that's one of the things that people will say. It's like, oh, you're going to burn yourself. But I mean, if you're comfortable with like cooking hot items and waiting for them to cool down enough so that you can comfortably eat them, then you can do the same thing with steaming. So it's just waiting for it to be a comfortable temperature. And so a lot of times I hold my wrist over it just to kind of bring a sensitive area to like test the temperature. And sometimes my wrist says it's okay, but it's still too warm for my yoni. So just know that if you sit over it and it's still a little too hot, just get out of there and wait a little bit longer. And then you would sit over the pot, and I'll talk in a second about like the different ways to set up, but basically you'll just be over the steam in some position for 10 to 45 minutes. And the time frame depends on what you're working with. The general rule of thumb is 30 minutes for most people if you don't have any contraindications for doing that length of a steam. But if you have an IUD, no matter if it's hormonal or not, you can only steam for 10 minutes. When you do your first steam, it's good to start with 10 minutes and just kind of see how you do. And if you're prone to really heavy spontaneous bleeding, you would only do 10 minutes. Also, no steaming during your period, during like the active fresh red bleeding phase, no steaming during pregnancy. And the exception to that, which is kind of interesting to talk about, is doing it for labor preparation, which that doesn't start until you're 38 weeks, but that just basically helps to ripen your cervix and just kind of soften all of the tissues in your pelvic area. And that is something that I did for my own labor preparation. and had like pretty efficient first birth, which I don't know if it was specifically because of my steaming, but there's a blog on my website about that, specifically like what I did and what herbs I used and things. But there is some nuance to using it for that, like there is with using it for anything. And so I want to go back to the different setup. Okay, so the first steam setup is considered the mild, which is if you're doing it for 10 to 15 minutes and you don't have a heat source underneath the pot throughout your steam, that's considered a mild. So you're relying on the initial boil that kept your herbs warm, and then just however long it takes for the steam to completely cool off where you can't feel it anymore. So that's kind of like the 10 to 15 minute range. And so there is a way to do that by putting this is in the video that you saw that's on my website.
In the toilet.
Yes. So you put the entire pot in the toilet. I've had many people ask me if you pour the herbs and the water into the toilet water, but please don't do that. You just basically put the entire pot into the toilet bowl. So it's just kind of like using the toilet bowl as a vessel to hold the pot. And then you just you sit on the toilet, and it's basically just to hold in the steam and give you a comfortable place to sit. But some people, especially more recently, have been kind of skeeved out by that, like haven't wanted to use the toilet. So I was
thinking of hygiene reasons. When I looked at that, I was thinking of the hygienic reasons. I was thinking, gosh, if I put a pot in the toilet, I'm going to have to use that pot for that particular purpose all the time and mark it so that I don't get confused, because hygienically, I would have thought that wasn't very good.
Yes. So I do, every time I tell somebody to put a pot in a toilet, I say, this is your yoni steam pot. Like, just leave it in the bathroom. Like, don't ever bring it back into your kitchen. So for that hygiene purpose, like, yes, definitely only use the pot for that purpose moving forward. But other people have been concerned also just about like what's inside of the toilet bowl. So I would just advise for people to clean the toilet bowl prior to steaming with some kind of natural cleaner, so you're not like bleaching it right before you steam in there. But still, some people didn't want to do that, and I do kind of understand. It's nice to kind of make it a little bit of a ritual. You certainly don't have to make this big thing out of it, but I do find that it's more relaxing, and I feel like I get more out of it if I really make it a beautiful experience. And I found that a little bit harder to do using the toilet. So the other way that you could do a mild steam setup without purchasing any additional materials would be, and not everybody's going to be comfortable in this position, but I'll try to describe it. So you're on your hands and knees, and I usually put a pillow underneath my knees so that they're not like digging into the floor. And then you put the pot underneath your hips, and then you bring your hands, like interlace your hands and come down onto your elbows and kind of just like rest like that. So you're fully supported, because if you were just like standing, squatting, you would get fatigued pretty quickly. But that's a way to keep your upper body supported. But you do need to have like a certain level of hip flexibility in order to be comfortable in that position, even for 10 minutes. And then doing it that way, you would also want to wrap your lower body in a blanket. And I'm actually working on I already made the video. It's on my Instagram. So if people want to go check that out, it's a reel on my Instagram of me like kind of demoing that position. And it shows like all the steps, like boiling the herbs, getting into the position, and then covering yourself with a blanket in the end position. And I'd like to get that onto my YouTube channel, but I just haven't done that yet. So that's the other way. And then the advanced steam setup, where if you were going to do like a 30 or 45-minute steam, for example, you would need to have some kind of heat source in order to keep the water hot for that long and to keep the steam going. So I just use a little hot plate, basically a little electric hot plate, and I put it underneath my steam sauna, which is basically just like a wooden box that has a hole cut out of it. Mine is like a diamond shape. They have just circles. There's advantages to the different shapes. I personally like a little bit of like a wider.
It's more, I can imagine it to be more comfortable.
Yeah. And so, yeah, so the one that I have right now is really beautiful with the diamond shaped, but I don't like the feeling of it as much as I have another one with like a bigger hole. So yeah, so you put the hot plate, and then you could do the initial boil on that hot plate, and then you would just turn it down onto low, take the lid off, put the sauna over it, and then you would just sit down. And the same thing, you might need to like sit down like, oh, that's too hot, and then stand back up again and wait for it to cool down. And then, yeah, you could just be there for 30 to 45 minutes. A 45-minute steam would be appropriate for somebody that has a lot of stagnation, which would be indicated by having like cysts, fibroids, endometriosis, as long as they don't have really heavy bleeding in conjunction with the endometriosis, or if there was a lot of like dark blood or clots, for example, or a lot of pain prior to or during your period.
But you mentioned you wouldn't do it during a period anyway, so I guess.
Well, yeah, right. So the way for period pain, for example, and this is where like all the different protocols, depending on what you're working with, come in. But for period pain, because that's something that a lot of people can relate to, the general protocol is to steam 1 to 3 days before your period starts. So if you have a really regular cycle, or if you're tracking with fertility awareness or something, and you pretty much know right when your period's going to come, you can steam before the period. And then at the end of your period, when it starts to become like the spotting at the end, which a lot of women have, that you can start steaming them. It's basically just during the fresh red bleeding that you don't steam.
And when we first talked, this is something that I'm intrigued about, because when we first talked about yoni steaming, but before we had this interview, I asked you about a pap smear, because I said that when I have my pap smears, they're really, really painful, and I really don't like them because it's just so tight and so painful. You said, I think you said, please correct me if I'm wrong, that yoni steaming would be good for that. So if I wanted to do that, and you said you have herbs on your website, if I wanted to go ahead with that, do something like that at home, would you sort of, how would I go with what you've just told me? But have you got any herbs on your website that I can use for that particular part of yoni steaming? Because I think it would be so helpful for me, because it's just so painful when I have pap smears. I hate them.
Well, I think I also said to you that I always ask for the small speculum.
Yes, you did say that to me. I remember you saying that to me. Yes.
Yeah, so that is my first recommendation. But also, yes, for steaming. So I kind of would put that in the category of people that have pain with sex, or with like inserting a tampon, which I don't know if you would specifically say that this is exactly what you're experiencing, but have you ever heard of the condition called vaginismus?
No, I haven't.
It's basically like if you're, and there are huge varying degrees, like where some women can't insert anything. It's like completely closed up and tight. And then other women experience pain trying to insert anything. And that's been my personal experience, both with having a speculum inserted, having sex, inserting a tampon. All of it has been really painful for me. And what I've observed is that with regular steaming, that has been much less. And the times when I would kind of not be so good about my self-care, that it would come back and it would start to be painful again. So basically, you could try to steam just right before you're going to go, before you're going to have an appointment. But probably what would be better is if you did it weekly, for example, just to kind of like get your body used to softening. For things like that too, pelvic PT was something else that I did. I know it's not really related to something that I do, but there are actually a lot of people that do Arvigo abdominal massage that have also studied with Tammy Lynn Kent, which this is something I would like to do, but haven't done yet. They do holistic pelvic care, which is similar to pelvic PT. And I've talked about it before, but I don't exactly know how they differ. I would imagine that the holistic pelvic care takes into consideration some more of like the energetics, and pelvic PT is more like anatomical, but I did find that very helpful too. But yeah, regular steaming and weekly is kind of just like a general rule of thumb. There was a period of time where just for experimentation purposes, I was steaming almost every single day just because it was like a thing that I liked and had time for at that time. In terms of herbs, it kind of depends. I mean, I would say just the steam alone would be helpful, but also if there's some dryness issue, which sometimes there can be when there's pain with inserting anything, the moisturizing blend could be nice for that if there's any dryness. And then in general, like my most sort of universal blend is called the clearing blend. So both of those could be options for something like that.
Oh, okay. No, thank you. You've given me some, because I'm sure I'm not the only one that finds it painful that those. I mean, I don't have periods anymore. Luckily, I'm really pleased that I don't. But I used to find putting tampons in really hard. I couldn't. I mean, I forced myself to do it because I preferred that than having pads. But I used to find it so painful.
Yeah. So and one other thing I wanted to mention about steaming, since this is a mom's podcast, is mostly what it has been historically used for is postpartum. Basically, what the main things that it's doing are to clear out the lochia, which is the blood and tissue that's left over after childbirth. That is why you bleed for 6 weeks after you give birth. Most people bleed for that length of time. It's different for everybody, but it helps to make sure that your body completely clears that, because if it doesn't, you could potentially have more painful periods and some other issues that crop up over the years if it's not completely cleared out. It also helps the uterus go back to its original size and can help with swelling, and also if you have, I didn't experience this, but some women can feel their uterus contracting back, and particularly while they're nursing, they can feel almost like contractions, basically. So like cramps in their belly. So it can help to alleviate those as well. It can also help with breast milk supply because yeah, so the menstrual blood and the milk in Chinese medicine are viewed as having the same source. And so one of the things that steaming, depending on what herbs you choose to use, can help with is preventing an early period return. And this is very general information. It's so individualized that I don't want anybody to think that something's wrong if they had a different experience. But for a lot of women, the period will stay away while you're nursing for a certain length of time. And the reason for that is to make sure that you are producing enough milk. And if you were bleeding and producing milk at the same time, that would be really depleting for your system. And so by some of the herbs can help to prevent your body from getting your period back too early, so that would potentially deplete your milk, basically, is kind of how it is looked at. But there are some people, like my acupuncture mentor, for example, that was able to bleed and have breast milk and still be very robust and healthy. So this is just like a general rule of thumb that yeah, preventing the period from coming back too early is part of how that works.
And if you've been, because I know some women when they give birth they tear, and if you've got stitches, is it advisable to use that? Because I would have thought yes, but also it might dissolve the stitches too soon. I don't know. I've got no idea. I was just mentioning that.
Yeah, so definitely, yes, it can help with tearing and with pain. And yes, you can steam when you have stitches. And that is not, I didn't have any tearing or stitches, so I can't speak to that personally, but I know that
I haven't either, so I can't speak personally, but I was just imagining a woman who's given birth and has got stitches and is, in pain because of the tearing. And I just wondered, if it would help.
Yeah, so definitely it can help with that. One thing I will say, that because I learned about this before I had a child, and I was just like, oh, postpartum steaming, everybody's got to do it. And I found it really uncomfortable because I just have a wooden box, and I wish that, and I have like a toilet seat cushion that I used for steams when I was facilitating them in my office. but I had left it at my office and I didn't have it at my home. And then COVID, and I had a newborn baby, and it was not prioritizing that, but it was uncomfortable because I had just given birth. And so I did have some pain that it felt kind of uncomfortable to sit on the sauna. So I would just say anybody that's steaming postpartum, maybe just get like a nice cushion for yourself, but it has to be something that has a hole in it so that steam
yes,
can
of course.
get through.
Yes.
So something like a toilet seat cushion worked really well and then also just be aware that it could potentially increase your bleeding, which it did for me. And I never felt like it was depleting me, which this is part of why it's helpful to work with somebody if you're doing it, because then you can kind of say like, oh, this happened, like, can you tell me what to do now, or like, should I change my herbs or should I stop, but because I have that training, I kind of was just doing it for myself. And certainly if you were doing it yourself and you were concerned at all, you could just stop for a few days and then start up again, because the protocol for postpartum is to steam 30 days in a row for 30 minutes. Yeah. So that's just to make sure that everything's really cleared out, you're healing everything. And yeah, it's a time when your cervix is still open, so that there's also an opportunity to heal from sort of like longer lasting, if you had any sort of period issues, that would be a time where you could kind of work with that, and steaming would help that. Yeah.
So you're basically saying that it's better to, have a consultation with somebody too as well, because you're giving them support at the same time, and you can talk them through different things.
Yeah, definitely. I mean, unless you feel very confident in knowing your body and listening to your body, which some people definitely do. And a lot of times I'm inviting women to listen to what feels best to them intuitively. So if somebody feels really connected to that, they could certainly do it themselves. But if they would appreciate some support and guidance, then yeah, that would be a good thing to do. Yeah, have a consultation.
Before we go, there's a couple of things about acupuncture. I'm not going to go too much into that, but I've had acupuncture done myself, because I used to have really, really sore backs, and I used to have acupuncture, and acupuncture was the only thing that actually helped. I haven't had it done for ages, but I used to be really afraid of the needles. But then I sort of thought to myself, bugger this, I'm going to try it. And I know from experience how wonderful it actually is. But I'm guessing from somebody who hasn't experienced acupuncture, can you just, not to go into too much detail, but just a sort of brief description of sort of what it's about, if people haven't experienced it? Because I know some people, well, like me, I was afraid of the needles. So.
Yeah, I mean, so I hear that all the time, that people are afraid of the needles, and I never push for people to do something that doesn't feel comfortable to them. And I think that if somebody's really, really scared of needles, there are probably other treatment modalities to try first, depending on what you're working on. But a lot of the time, people are surprised by how little they feel. I think that they have this association with like a hypodermic needle and how that feels, and it feels really different from that. And I imagine that you had that experience as well.
I did. Yeah.
Yeah. And I would say too, that especially as you get used to it and you get acupuncture regularly, people just get so comfortable with the sensation that a lot of people fall asleep during their treatment. I know that's certainly happened to me before.
I can't remember if I did or not. I probably did, but I can't remember.
Yeah. Or it can even be that kind of like space in between asleep and awake, kind of like a meditation. It doesn't have to be that way to be effective, but for a lot of people, it can be. So how to be concise about explaining acupuncture. So I could try to give you a little bit of like a short description. Yeah. So basically there's a lot of different styles of acupuncture too, just to throw that out there. But the way that I practice is basically we get an overall picture of all of the symptoms that you're experiencing all over your entire body, even if you were just coming for back pain. Or for example, if a woman is experiencing morning sickness, for example, we would be talking about her entire system, your entire system, to identify an overall pattern of diagnosis that is a Chinese medicine diagnosis. So, and that would be individual to you. And I won't get into what they are because their names can be kind of confusing. And I think it would just make everything more confusing than we need to. But so basically then I would select a number of acupuncture points to use that would help to treat that pattern. And so some of them are used in conjunction with each other. Like there's, a couple different sets to use for this specific thing. But basically I'm creating this overall harmony in your body to try to address that pattern and specific symptoms that you're experiencing. So that's sort of why, a lot of times people will come in for pain and then they're like, why are you asking me about my digestion? Like that doesn't make any sense. And sometimes it's irrelevant. We didn't even really need to talk about it, but it's important in Chinese medicine to understand the overall picture to give the best treatment, basically. Yeah.
So is there anything else before I ask you your final question? Is there anything else you'd like to add?
No, not really.
And if anybody wanted to find out about you and find out about what we've been talking about and go to your shop and buy the herbs and whatever, how would they do that?
Yeah, so my website is rosebudwellness.com. And the shop is rosebudwellness.com/shop. And it's actually on the website too, on that main website. And then I'm also relatively active on Instagram. So it's rosebud_wellness. And then all of my contact information is on my website.
Okay. And one final question. What magical tip would you give to a first-time mom in relation to what you do?
That's a great question. The first thing that popped into my head was to take good care of yourself. Not really anything in particular, not necessarily acupuncture or steaming, but just to do something that feels really, really good to you and feels really nourishing to you. Yeah, I have a 17-month-old and I have to tell myself that all the time. So yeah. Okay. Yeah.
Thank you, Holly. It's been amazing. I've had a lovely chat with you well, thank you so much for coming onto the podcast. I've really, really enjoyed talking to you. Holly shared some great tips on women's holistic health in this episode, and I've learned a lot from her. You can learn lots more from Holly from her podcast, which is called Womb Wisdom, and there's some great videos in Holly's YouTube channel. I've included links to these in the show notes and to Holly's website, an online shop. You can access the show notes by going to mybabymassage.net/podcast/031. mybabymassage.net/podcast/031. If you're looking for additional help or resources, I also run a free Facebook group called First Time Mums Lounge. So please join me and you'll gain access to tips to help you and your baby through the beginning stages of your journey. You can access the group by going to mybabymassage.net/Facebook. mybabymassage.net/Facebook. I also welcome questions, comments, and feedback on my podcast episodes. Please feel free to reach out by sending me an email at info@mybabymassage.net. info@mybabymassage.net. And once again, thank you so much for listening.